you're very well placed to be using the laser because you've got a wide skill set when it comes to eyes. And it was just more to discuss your sort of findings with the laser, its application, and the things you like about it, and why you've onboarded it to your practice.
The journey for me really started with the clinical problem, with the aesthetic presentations that patients were coming with.
Okay.
We see a huge number of patients with a variety of issues around the eyes, but when they have malar edema associated with it, it makes everything very, very tough to deal with. And malar edema is effectively a collection of fluid in the looser tissues around the apex of the cheek and eyelid interface. Why it happens is very complex and probably beyond the scope of this interview, but it's a convergence of many different factors. But when patients have this presentation where they have fluid accumulating which they can't clear for whatever reason, anything you try and do to it could potentially make it worse. So acknowledged and accepted treatments like surgery could end up making it worse, because the trauma from the surgery and the swelling induced by the surgery can just mean that the swelling accumulates in that area, sometimes for months. And it's really, really tough to treat. Laser-based therapies, filler injections equally can cause an exacerbation of the edema. So we were kind of cornered with this particular clinical problem, and we've been looking for novel technologies to address this for some time. And that's why I was really excited to see Endolift, because I think it was very biologically plausible, the idea of addressing these loose areas of tissue by delivering energy subcutaneously in a very defined, precise and targeted fashion. I thought was really, really exciting. So we took this laser on board. We are very evidence-based practice, and our first priority was really to get a collection of data, look at a series of patients, look at outcomes, and it was very positive. And we saw that a large number of patients were really getting significant improvements.
Brilliant.
In a way that we've not seen any treatment being able to address this before. And it's very rare to get that in aesthetics, and there are all sorts of treatments out there which people are selling, but there is a very limited evidence for them. This is really hard evidence that it works, and we plan to collect more data and publish more on this to better understand the patient groups it works best in. But it's been, it's exciting for us as clinicians to find novel treatments that can really address patient concerns.
Fantastic. So if I was a patient coming to you and I had a concern with my under eyes, and if we're talking about managing expectations, because that's hugely important in everything we do, and patient selection, and I said to you, in terms of I want to improve the under eye area, what percentage, and I know this is difficult because everyone is so individual, would you say it's a lower percentage? Would you say it's a 20 to 30% improvement? Would you say it's mid? Would you say it's high? Or is that purely on a case-by-case basis? I know that's a very, very tough question to answer.
No, but it's a very important one. And what it appears so far is that there are certain patient types where it has a very high impact, and certain patient groups where it has a very low impact. Generally, patients with more delicate features who have less tissue bulk appear to be the patients that benefit most. And that's going to be part of the preoperative consultation, to try and give as much data as we can to convey that to the patients, to try and give them a realistic idea of the likelihood of it working, and then the patients can make an informed decision. But I think that is really the next area, is to really kind of drill down on these clinical differences, to enable us to predict who is going to respond and who isn't. Because patients need to know that. And Endolift as a standalone treatment, look, there's no silver bullet in the world of aesthetics. We sometimes need to stack modalities, or even surgery and things like that. As a standalone treatment, do you think that it covers everything that's needed, or do you think there needs to be some other slight interventions that match what it does or complement what it does? Again, a really, really important point. And it is exactly as you've said. Often we need to use several different approaches to attack a clinical problem. So malar edema, for example, and festoon formation, it does have very, very effective surgical solutions. They don't always work. And as I said, they can exacerbate the edema sometimes. So we're seeing patients having the Endolift treatment and then potentially going on to surgery as well, if they feel they haven't quite reached that threshold point at which they're satisfied with the outcome. So even if Endolift isn't as effective as they would like, it would enable us to then provide further treatments and further other modalities.
Which is hugely useful for someone coming to you specifically here in Harley Street, because there's a lot of practitioners, including myself, that offer the treatment for festoons, but that's our ceiling of what we can do. So I guess when it comes to working with the eyes and Endolift, that is what makes you quite unique, is that if there's something further that needs to be done, then you can then have that conversation. But I guess also ultimately it comes down to the patient satisfaction, because they might go, do you know what, Mr. Ezra, fantastic job with the Endolift, you've absolutely knocked my socks off. Or they say, yeah, I'm happy with this for the next few years, but maybe in a few years' time they would want to consider something else.
And you're absolutely right. And I think we spend so much time in our clinic in communicating well with patients to really understand their expectations and then being honest about what we can achieve with the treatments. And what's really critical is ensuring that those two things marry well. And where they don't, then we have a problem, then patients are left unsatisfied with the treatment. And we do everything that we can to communicate that as best we can. In clinic, through assessments, and also through novel imaging technologies as well. We often will use 3D surface mapping of the face. We can use 3D MRI scanning if there's pre-existing filler in situ. So there are quite a few different technological approaches that we can also use to help facilitate that discussion.
Brilliant. I think this has been a really useful discussion, because a lot of the times when there's new novel treatments that come on, people like to talk purely about how it's the most fantastic thing, it does X, Y, and Z. And I think the conversation that we've had here is actually quite an honest conversation, because we're talking about the complexity of the eye area, which is hugely complex, and how we approach it, and what people can expect with Endolift, or managing those expectations, which is really good. Is there any other sort of final comments or thoughts regarding Endolift that you would say to someone that was curious in the treatment, wasn't too sure where to start, how they could go?
I mean, I would say that I think this really is a groundbreaking treatment. I think it is a treatment that opens avenues that simply weren't there before. But I would emphasise it doesn't work on everybody. And the philosophy of my clinic and my practice and all of the doctors that work with me is to be honest about that. It's to give patients the right information so that they can make the right decision. We don't market it as a miracle treatment. It's about being honest about what we can achieve and what might be more difficult to achieve. But what we're definitely seeing is significant improvements in certain groups of patients, quite large groups of patients. And we're going to be continuing to further refine our understanding of which patient groups that works best in. And to do that, we need more patients, we need more data, and we're going to publish more data.
Brilliant. Okay, thank you, Mr. Ezra. I appreciate that.